know that 70% of diseases are preventable? Preventive health care is just as important as eating and sleeping. Preventing diseases and accidents are something people don't take seriously and look over, but prevention is better than curing. According to Sharpay and Raquel in the article Guide to Preventing Diseases, heart disease, cancer, and strokes cause more than half of the deaths in the U.S. each year, and many could have been prevented. Research shows that 45% of cancer deaths are linked to such factors such as poor diet and lack of exercise. Having a healthy lifestyle decreases the chances of a serious illness like Alzheimer's disease, respiratory illnesses, strokes, and cancer. If you have a family medical history of illnesses or diseases, by starting to prevent it reduces the chances of getting the illness at all or getting too advanced. Protective care also goes into annual checkups, which would lead into catching of early diagnosis for diseases that people usually don't show symptoms for. Getting important vaccines to prevent illnesses and diseases, and even simple preventative care like regular exercise, eating healthy, dental care, and always wearing a helmet, seatbelts, and sunscreen. The problem with preventative care is some people sometimes might fear going to the doctors of lack of insurance or cost, anxiety, embarrassment, and just an overall traumatic place for many. They also might not know who is at risk and what items can contribute to getting the illnesses. Another reason would be people do not know that there are many preventative health care pre-measures or information on how to start preventative care, and just in general lack support. Also, one's mental health can affect overall care of themselves. A big reason is that some people believe that they don't have the risk factors and choose not to go to the doctors at all. This goes for the people who have a good, healthy lifestyle who think they should not go, but in reality, anyone can look healthy but can be very sickly inside. According to Abby Norman in the article Seeing the Doctor's Guide, sometimes a person may feel embarrassed seeking health care even if they do have symptoms. They may worry they're just being dramatic or making a mountain out of a molehill. They also might be concerned a doctor will tell them their symptoms are all in their head. And staying healthy is a big challenge to maintain overall. The solutions to these problems would be start with the doctors by telling people what ways to prevent certain diseases and preventive services available to them. Doctors realize if they spend more time with their patients, it reduces anxieties and even blood pressure. According to Dr. Patrick Penal-Endicott in the article Improving Health Outcomes Through Patient Education and Partnerships with Patients, to improve healthcare outcomes, physicians must spend more time with the patients. The teaching physician's interaction with the patient must be enthusiastic, motivated, and responsive to the individual patient's needs. Little exercise is better than none. According to Dr. Natalie Arzar in the article, What We Should All Be Doing This Year, the CDC recommends the following, and it's some combination of strength training plus aerobic activity every week. What they say is that you can moderate intensely aerobic activity for about 150 minutes per week plus 2 or more strength training, or you can do 75 minutes of vigorous aerobic activity. This ensures your body stays healthy and strong as you get older. Going to annual checkups and screenings for your age range, even if it does not seem necessary, but those 30 minutes can save your life from invisible life-threatening diseases. You can also look into the Affordable Care Act, which was created in 2010, which has three preliminary goals. Make affordable healthcare available to more people, expand the Medicaid program to low-income adults, and support innovative medical care to lower health costs. This act provides numerous preventive health coverage that protects your rights and is fair to you. According to Xavier Becken in the article celebrating the 10th anniversary of ACA. ACA is the Affordable Care Act. Thanks to the ACA, the number of uninsured Americans has declined significantly, from 50 million to under 30 million. In other words, it's less than 10% of the population over the last decade. The ACA has not only increased access to care, but expanded Medicaid and the Children's Health Program, CHIP, which collectively serves 137 million Americans and reduced disparities in coverage for millions of people, including the LGBTQ community and communities of color. The forecast for preventive care will lead to a better quality of life. With a healthy living style, you will feel better physically and emotionally. All the exercise and healthy eating, your body will thank you. Results in lower medical costs as you are preventing the illness from even occurring, and will also lead to less preventative deaths each year. Each year, the rates for preventative deaths become more and more, and with everyone doing preventive care, it will lessen. Doing preventive measures are very important for patients and doctors. Doctors are less likely to get burned out or less stressed, and patients will get to live their longest, healthiest lives. You would also save money because you would not buy unnecessary junk food or drinks. You would get to finally take control in your life, as healthy living makes one feel more controlled. Me personally, I have been working out and doing sports my entire life, and I have no health problems, and it makes me feel better mentally. I highly recommend seeing what exercise you like and what suits you. If you do not use preventative care right now, you should start with seeing your doctor and ask questions and discuss any questions you might have and ways to start your journey in starting preventive care to get a better understanding personally. Educating yourself to what preventative care goes a long way, especially if you have family medical history and you can see what scans or tests that are usually used to see if you are a risk factor. Doctors recommend that if you have a strong family medical history, it is highly recommended to do extra preventative care. And it is also an advantage because even if you progress the disease or illness, preventive care will catch it early and it's easier to treat. Starting preventive care, you are already on the road to a long lifespan. Both doctors and patients need to realize how important preventative care is and something to add to your routines to have a better quality of life. You might not know, but listening to my speech, you're already saving valuable minutes of your life with your family, friends, and loved ones by listening ways to expand your life.